Hey guys, Davin Lim, a board certified dermatologist. Today we'll be talking about acne, but also how to treat acne at home. So what you can do to make that difference to your skin without seeing a dermatologist. Now guys, when we talk about acne, we've got to understand what causes acne, and hence we'll be able to effectively manage this condition. So acne is kind of easy to understand. It's basically a genetic condition that's made worse with environmental factors. So the underlying cause of acne is an excess production of sebum or oil. So your skin contains these oil glands called sebocytes, and these sebocytes are in your sebaceous glands. And what happens over time, it has input when it comes to things like hormones, genetics, certain medications, diet, stress, and factors like that. And what happens over time is that these factors activate the oil gland, in turn producing more oil, and with more oil you can have increased amount of bacteria, and with increased amount of bacteria that's when you can have acne lesions, pustules, pimples, cysts, etc. So if we treat the underlying condition, in other words, if we reduce or modulate oil production, we can markedly improve acne. So how do we do that? Let's go to the basics. First of all, what can make it worse? I always advocate an acne-free diet. The reason being is that in some cases, it can work quite well. So basically with diet, what you want to do is you want to reduce the amount of sugar. So if you can reduce the amount of sugar in your diet, that can reduce the amount of something called IGF-1 or insulin-like growth factor. And what that does is that can modulate your oil gland or your sebaceous gland and decrease oil production. So sugar, number one. Number two, dairy. So if you can cut down on dairy, that can make a big difference. Number three, processed foods. So if you're having a bad diet, that's the first thing you should do is modify your diet, go on an acne-free diet, and in many cases that can work. More on diet up here, but let's move on. So we talk about diet. What can you do when it comes to skincare? So for skincare, I can provide a simple solution. So this video is sponsored by Dermal Therapy. Now hear me out, Dermal Therapy has got a long track record with dermatologists to make products which actually work. So instead of using a whole heap of expensive skincare, they provide cost-effective solutions with a lot of background science. So the first thing we will talk about is cleansing and why it's super important. So with Dermal Therapy Acne Control Wash, this is an ultra gentle foaming cleanser. So it can effectively unclog pores without stripping the skin of its essential oils, which is super important. Because when you look at traditional washes, they contain what's known as benzoyl peroxide or salicylic acid. So what benzoyl peroxide actually does is that it can kill the skin's natural microbiome. And this is the good bacteria, because benzoyl peroxide is aimed at decreasing bacteria, but it does so harshly as well. So with the Dermal Therapy Acne Control Wash, it can reduce sebum production using something called SeboClear, which is free of salicylic acid, which can be irritating, and certainly free of benzoyl peroxide. Super easy to use. Basically wash as directed twice a day, morning and night. So the second product from Dermal Therapy, which is included in the kit, is this, the Acne Spot Cream. It's a targeted spot treatment which effectively reduces acne breakouts. So unlike other creams which can dry things out, this one contains alpha hydroxy acids, and what it does is that it unclogs pores. It acts as an exfoliant, but most importantly, it contains certain things which help with acne scarring. So it contains niacinamide, alpha-arbutin, as well as bakuchiol. All of these are effective anti-scar treatments, and they can reduce both pore sizing, importantly reduce the amount of potential scarring that you get, and also reduce pigmentation or post-inflammatory hyperpigmentation. This product also contains active silver ions and also colloidal sulfur, which helps clear acne breakouts by reducing the amount of bacteria in the skin. Importantly, it also contains SeboClear, which is basically great for hormonal acne as it reduces sebum production. So much like the wash, you want to apply this either once or twice a day to the spots. So let's move on to the third product in this range. The third product is the Dermal Therapy Acne Control Lotion. It's a daily oil-free moisturizer that effectively reduces breakouts. It helps with the skin's hydration because it contains hyaluronic acid, and it also has what's known as polylysine. The bottom line is this: keep things simple with your skincare routine. Basically, you want a cleanser, a spot treatment, and a lotion, and that's it. Consider adding a acne-free diet into your routine, and generally speaking, most patients will get good results, generally speaking within 3 to 6 weeks. It does take time for your sebum production to decrease, and once your sebum production decreases, the oil in your skin decreases, the amount of bacteria proliferation in your skin decreases, and hence your acne improves over time. Guys, I hope you liked that video. It's a simple solution made possible with dermal therapy.